Hi, I'm Michael Couture, and this is the West Block, politics, perspectives, and players. Now, earlier this week, the United Nations released its climate report, and it shows nations around the world are falling short on their 2 degrees Celsius greenhouse gas emissions target agreed to in Paris 3 years ago. A new report here in Canada adds that failure to reduce emissions is having a significant impact on our physical and mental health. Now, the report by Lancet Countdown includes recommendations for a healthy response to climate change. Joining me now is the lead author of that report, Dr. Courtney Howard. Thanks so much for being with us. Break this down for me right now. In this report, you actually say that climate change has a negative impact on our mental health. How so?
Yeah, so just to clarify, there's a big international Lancet Countdown project. So if you think about it like a wheel, the hub of it is this giant data-driven report. The Lancet Countdown is like a report card on health that's going to get issued every year between 2017 and 2030. And then emanating out from that, like spokes, are in-country policy briefs that draw data from that report into the different countries and situate them in the political and policy context, so we can, make productive and sensible action. So I was the lead author on the Canadian policy brief and actually helped to coordinate the international policy brief process. Yeah.
So now on the mental health, I mean, a lot of people look at this and say, of course, the air quality is worse and that may be causing respiratory issues. But on the mental health side, how is that affecting us?
Yeah, so there's been studies done in multiple different contexts that show that different aspects of climate change are having impacts in terms of increasing anxiety and depression. We know that all of these increasing amounts of extreme weather events and wildfires, when the people had to evacuate so urgently from Fort McMurray, past stressful flames into new and unfamiliar circumstances, there's post-traumatic stress been shown to be associated with that. Anxiety's been seen in those populations. In terms of other extreme weather, you can imagine that if your house is destroyed, there's additional stressors on you. So that can lead to increased anxiety, increased depression, increased levels of substance abuse. So as people try to cope with those situations, sometimes in a maladaptive way, they can turn to other ways of trying to make themselves feel better that aren't really good in the long run. And we've actually seen some preliminary evidence out of the U.S. that heat waves are associated with an increase in suicidality. We all know somebody who gets, irritable when they get hot. And if you think about people who have, a tendency towards depression or anxiety, and then there's the additional factors of being really hot and potentially not being able to seek shelter, that can, lead them to have suicidal thoughts. And in Canada, we've actually done some interesting research, particularly in the north, because we know that our north is warming up faster than most other regions on the planet. So I'm an emergency doctor in Yellowknife. Yellowknife is already 2.5 degrees Celsius warmer than it was in the 1950s. And I serve a population in Inuvik and around the Mackenzie River Delta that's actually living somewhere that's 3 degrees Celsius warmer than it was in the 1950s. So there are people alive, in Inuvik, in that area, who've seen a 3 degrees Celsius warming since they were born. And so that has consequences in terms of, decreased stability of the ice for ice roads, which makes it difficult to hunt, to gather food for families, makes it more dangerous. And it just makes things look different. So research that we discussed in the report out of northern Labrador, Indigenous populations there done by Ashley Consulo and her team in association with the Indigenous communities really shows that all of those have an impact on people's relationship to the land and how they feel about their home, because they've stayed at home, but now their home looks different. So there's a word called solastalgia, which means to feel homesick when you're still at home, and that's what people there are experiencing.
So it really is sort of that mental anguish that you're feeling, even though you can do nothing about it as it's happening around you.
Well, it is just really disconcerting when the world is changing. We saw a similar thing in the wildfires that we had in 2014 in Yellowknife. We had really deep wildfire smoke off and on for about 2.5 months, so people were stuck at home. And when we did an interview-based study with people experienced, sadness, loneliness, anxiety. They felt disconnected from their neighbors. They were unable to access the outdoors, reduced physical activity, which made everybody irritable. And then this feeling of, well, what does this mean for us long term? Is this the new normal? What do I need to expect from my children, and how can I, prepare them for this world, and do I need to take action in this world in a new way?
To that end, I mean, we are seeing it all around us, yet government action sometimes is slow. We have the U.S. that is no longer in the Paris Agreement. What, first of all, can Canada do right now? And do you think that this will finally be that bell that sets it off and finally sets everything back into motion going the right way?
Well, I am feeling over the last year, just from what other people are feeding back to me, that Canadians are feeling this in a new way, you know? So we've seen, we know that scientists have been telling us for years that the climate is changing, but, you know, with 90 heat-related deaths in Quebec this year, with the wildfires that blanketed BC and Alberta, and smoke that spread all the way to Winnipeg, with the drought and crop-related disruption on the prairies, which impacted even cattle. People with the tornado that touched down here in Ottawa, the flooding in New Brunswick, it feels different. People are seeing it in their day-to-day lives, so I think it makes it easier for us to make that diagnosis ourselves. And so we know that the World Health Organization says that climate change is the biggest health threat of the 21st century, and the Lancet has previously said that tackling it is our biggest opportunity. So things like phasing out coal plants will decrease greenhouse gas emissions, as well as air pollution that causes, you know, asthma exacerbation and lung cancer and other related deaths.
But then, if you don't mind me interrupting, but then you have President Donald Trump wanting to reopen coal plants. I mean, no matter how much we do here in Canada, how much is what the U.S. is doing or not doing just going to lead the way either way?
Well, what's really exciting about this report, so I helped edit the US-based report, which also talks about the health benefits of phasing out coal, as well as the one in China, which talks about massive air pollution reduction. That's an opportunity for them. So if we start thinking about this in terms of how we feel right now, you know, all of these measures that we can take to decrease greenhouse gas emissions and reduce air pollution will just clean our air. Our kids will miss less school because of asthma exacerbations. Our world will look brighter. You know, when we have bad air pollution, the world just feels somber, you know? And so these things that we can do that make us feel better now, that save us money in terms of healthcare dollars. So one of the Lancet's main recommendations, and they've been saying this since their 2015 multidisciplinary commission, which had doctors and economists and financial planners, and they all said, look, so we know that this is a big health threat. We need treatment for it. And when we all look at what our skill sets are in our toolboxes, the biggest, most effective tool we had is to put a price on carbon. Because what happens then is similar to measures we've taken in public health to help phase out tobacco. It just makes it easier for people to make healthier choices. So the Lancet says, you know, a strong, sustained, broadly applied price on carbon that goes up in a predictable manner so people can make decisions, can forecast out, okay, so the price on carbon is going to go up by $10 per ton next year. That means it's going to get increasingly cheaper for me to buy the hybrid car instead of the fossil fuel burning car, because I'll save money in the long run. So if we pull together and look at this as a public health emergency and treat it the way we treat other public health emergencies, it's a really big opportunity for us to make real progress.
We only have about a minute now. When you talk about it's an opportunity to make progress, how critical is it now, though? Are we at that point where it's the point of no return? Because we feel like we've heard this many times before.
Well, I think there's a reason you have an emergency doctor sitting here talking to you. So I am very triggered by time-dependent situations. And when I look at this, I get the same feeling I get when I see, you know, I hear the code blue alarm going off in the emergency department. So when that happens, what you do is you walk quickly, you don't run, you don't panic. You walk quickly in a directed way to the place where there's the problem. And, you know, if someone's heart has stopped, you do CPR. And what we talk about that is you push hard, you push fast, you don't stop. So this requires an emergency management type of approach. And
a code blue for the environment.
This is a code blue for the environment. It's not an accident that half of my brief authors were emergency physicians. You know, this is a situation that requires urgent response. And we can do that. We know how to do that as humans. We just need to get on the same page and start acting for the benefit of everybody.
I appreciate your time today. Thank you very much for joining us, Dr. Howard. Well, that's all the time we have for right now. I'm Mike LeCouture for the West Block.